All right, hello everybody. I'm going to get started. We may have some people joining as we go, and that is totally fine. This is being recorded because I'm going to share it with people who couldn't make it live on the call later. But thank you so much for joining us. This is a webinar. Use that term loosely because I want it to involve as much engagement as possible. But basically going to be looking and reviewing the Medical Nutrition Equity Act, what it is. I think probably most people on this call will know what it is, but I'm just gonna review it anyway, just in case somebody's watching who's not quite sure. And then what the status of the MNEA is right now, and what our real key focus is in pushing the bill forward. There's only a couple more months left in this legislative session, and so it's extremely important that we push it through, which is something that will be repeated throughout this this call, you'll see. But I'm going to just dive in and get us started with a quick explanation of what the MNEA is. So the MNEA is a bipartisan bill that is bicameral, meaning it's been introduced in both houses, the House and the Senate. So the bill in both is exactly the same. There's no differentiation with wording, and it is to provide for the coverage of medically necessary food and vitamins and individual amino acids for digestive and inherited metabolic disorders under federal health programs and private health insurance to ensure state and federal protection for existing coverage. So that's the quick snapshot of what this bill would do. In more layman's terms, it would essentially make sure that there is a minimum coverage for the formula that we need and the low protein foods that we need in the PKU community with all health insurance programs, which many of you probably already know. This is currently decided on a state-by-state basis, and with some states having no coverage for these things and some states having coverage only until someone's 18 or having coverage only for children. It's just varies so much state by state. So even a state like New York, where we do have coverage is required, there are still loopholes through ERISA. So it's not perfect even in states where we have mandatory coverage. So it's really important to have kind of just something that's an accepted standard across the United States as the one country that we are. So I'm going to be sharing with you all a slideshow now. I think I'm going to need to share my screen before I make the slideshow go live. Do this. All right. So when I finish going through these slides, I'll open it up for any questions that people might have. So just keep a mental note or jot down any questions that come up for you as we're going through these. All right, so the current status of the MNEA is we have 125 co-sponsors total. So we have 24 in the Senate, which is nearly a quarter of the Senate, right? There's only 100 senators. So it's really not bad at all. And bills have gotten passed with less than 24 co-sponsors. So it's great that we have 24 co-sponsors. 18 of them are Democrats, 5 of them are Republicans, and 1 is an independent. And then in the House, we have 101 co-sponsors. Again, bills have been passed with less. 86 are Democrats and 15 are Republicans. Where we're at right now with co-sponsors is we need more Republican co-sponsors. The reason for that is the more Republican co-sponsors you have, the more pressure it puts for this bill to move through committee and be voted on, because the more you can show bipartisan support on something, the more likely it is to not face a holdup when it's being voted on, and the more likely it'll be an actionable piece of legislation for the government. So we want more Republicans to show that bipartisan nature, which the bill is, which is why we have 5 senators already co-sponsored who are Republicans and 15 in the House. And we just need, and there are some Republicans who, this will probably be a question that comes up later, why wouldn't more Republicans already be signed on? it's a combination of things. There are a few senators who are Republicans who have flat out said no to constituents who are very, very active lobbyists, like in Utah, for example, Mitt Romney and I forget the other person's name, but they both are very staunchly no. And sometimes a Republican will be that way because they don't want to touch anything related to healthcare. But there are a lot of Republicans who see the, oh, hello, Heidi. Speaking of Utah, Heidi is one of the fierce advocates in Utah. But basically, they want to, some Republicans will obviously clearly sign on and see the value in this. And I'm going to give you some Republican talking points as we go on to show you why a Republican might support it. Right now, we have a three-pronged approach for advocacy. So we have the Patients and Providers for Medical Nutrition Equity Group, which is a group of 45 allied organizations. It's called the PPMNE, and they've been working to pass the Medical Nutrition Equity Act to get it through Congress for like a few years now. And the National PKU Alliance is a member of the PPMNE. And then we have Crossroads, which is an NPKUA contracted lobbying firm. They've been working with us for the last year and a half and are going to be, they've been very instrumental in helping us get more of these co-sponsors on board, especially Republican co-sponsors. So Crossroads has a strong, one of the people who heads up Crossroads has a strong relationship with a lot of Republican offices. So it's really incredible to have Crossroads on our team right now during this legislative session. And then the third approach is grassroots, which is us, right? It's us reaching out and trying to get meetings with our senators and our representatives and sending emails and calling them and doing everything we can to get their attention and to get them to sign on as a co-sponsor. So the time is now. I cannot emphasize that enough. We are actively working to push the bill through before the end of the year. And if it doesn't pass by December, we will need to reintroduce it in January. That doesn't exist for me as an option. I think we will get it passed in December. That's the way we need to approach, and just, you know, everything firing at and getting it passed by December. That's the goal, and that's the way I think is most helpful to think about it. So our main goals right now, for those of you who attended the webinar that Sarah and I led this summer, you'll see that these points have been modified slightly because we've made progress, which is amazing. But our main goals right now, we have 3 Democratic senators who are both on the Committee of Jurisdiction, HELP, and co-sponsors on the bill. So they've already said, yes, we co-sponsor this bill, and they sit on the committee that's going to be pushing this through to a vote. The ask for these 3 senators is to please help us move this through committee before the end of the year. And those senators are in Wisconsin, Senator Tammy Baldwin, in Nevada, Senator Jackie Rosen, and in Minnesota, Senator Tina Smith. So if you are in Wisconsin, Nevada, or Minnesota, or if you have family members or friends who are in those 3 states, the ask is we would love for them to please move this through committee before the end of the year. And it's important that they hear from their constituents that this is a need and a desire that we have, because it'll keep it top of mind for them, so that they can actually prioritize that within the committee. And then we are still working to get as many Republican co-sponsors on board as possible. So if you live in a state with a Republican senator or representative, we need you now. We need you to reach out to them, and there'll be some more specific action item steps in a moment. And then the third goal that we have right now is actually more of an update than a goal. It's where we're at. Senator Casey's staff, Casey is one of the original sponsors on the bill, and they had sent the bill for technical notes to CMS, Centers for Medicare and Medicaid Services. This organization needs to review it and give technical notes, which then the authors of the bill will adjust and update the bill accordingly, which makes it more appealing to the committee. So in the Senate, that's the HELP committee, to prioritize and push it through, because Centers for Medicare and Medicaid Services weigh in on healthcare related things. So they finally got those notes back from CMS. That's something we've been waiting for a very long time. And now the senator's office are working on changes, which is great. And the same thing, we just received word, I think yesterday or today, that the House is doing the same thing. The House also got feedback and they're working on changes. So that's an enormously positive development that we're very happy about. Opportunities for legislative advocacy. So you can find, and by the way, so you don't worry about like furiously writing notes, I'm going to be sending this deck along with some other supplemental materials to help you as you advocate for the MNEA. So you will have access to this. So don't worry about like writing down the link or anything like that. But you want to find and call your senator and your representative, and nutritionequity.org/find-your-representatives is a great place to find out who they are. All you need to do is put in your address and it'll populate who they are for you below. And then you want to email your senator and representative. Again, this nutrition equity page, contact Congress. What's important to note here is that it'll auto-populate a letter for you to fill out, and you really want to personalize it as much as you can so that it's something that people will sit up and pay more attention to. And I would recommend personalizing it at the top. So adding some kind of and there'll be more on telling your story in a few slides, but you want to start out with something personal and make sure that they're aware that this is not just another blanket form letter. And then also the most effective thing that you can do is to request a meeting with your senator or your representative in person or virtual. A lot of meetings have been happening virtually lately, but some are also doing in-person meetings. So where possible, it's very powerful to ask for an in-person meeting because, Heidi was just talking to me about this recently. There's some tactics that people will use where they'll bring in the formula to the office and they'll have the senator's aide or whomever you're speaking to try a taste of the formula. Or another thing you can do is bring a banana, and you can do this on a virtual call as well. You just kind of bring a banana and say, for some people with PKU, this is all they can eat in a day, the equivalent of a banana if they didn't have their low protein foods or their formula. So basically they'd be starving. And just something that's visual can really help, shake someone up to listen to you more and kind of make a bigger impression. So right now we have some key target states. Again, I'm going to send this deck to you so you'll be able to reference it, but key target states are Wisconsin, Maine, Nevada, Minnesota, Washington, Ohio, North Carolina, South Carolina, Alaska, North Dakota, South Dakota, and Utah. So if you are in any of these states, we need you to reach out to your representative and your senator. A lot of these states have Republicans in office right now, and so the ask is for them to sign on as a co-sponsor. And for the states here that are listed that have Democratic senators, the ask is to help them push this through committee. So let's go on. So here are those Republican talking points that I mentioned. This legislation, and these are all points that are really effective in getting Republicans to see the value in passing this legislation and helping them understand, why this is something they should support for their constituents. This legislation allows patients to choose treatment options that are medically appropriate for them based on their specific needs in conjunction with their physician. That's the first point. Second point, TRICARE's coverage of medical foods has already set the precedent for national coverage. Coverage has been made a priority for our military and should be a priority for all Americans. Third point, children get this disease through no fault of their own, and it represents a significant financial burden for families. Medical foods cost as much as 5 times the cost of food. And then the final point, the financial strain on families to afford this food has only worsened with massive inflation, and these families, more importantly their children, cannot afford to wait. Democratic talking points. So again, we're not really, you can see this note kind of up top here, we're not currently seeking more Democratic co-sponsors, but we would ask if you have a Democrat in your representing you right now, to ask them to talk to their colleagues on the other side of the aisle, or to suggest who would be ideal for you to reach out to move this forward. You'd be surprised. I asked my senator if they would be Senator Schumer's office. We had 5 people on our Rare Across America call with Senator Schumer in New York this past summer, and all 5 of us asked if they could reach across the aisle to help push this through, and they were very receptive and said that they would be happy to do that. So you'd be surprised at the willingness people have to support and help when they get asked directly. So the Democratic talking points, I hope you've had a chance to kind of read them just now, but I'm not going to read them out loud just to conserve time and move on to the Q&A section, but they're pretty standard, you know, around like the Affordable Care Act. Democrats generally want to help, you know, expand and make sure we're continuing to realize that. And then there are, you know, basically what I shared at the top of this call are the Democratic talking points for why you would want to get this passed. So this advocacy through the media, right? So one tactic for grassroots activists is the last couple of slides I was talking about, where you have your major talking points, and then you're going to email or call or request a meeting where you can share those talking points in person with your representative and your senator. And then the other tactic that also should be done is to advocate through the media. So recently you probably saw on the news that there's a lot of advocacy, a lot of news coverage around the formula crisis. So it was a horrible thing to have the formula crisis, but it also was a really unique opportunity for people who relied on medical nutrition to get press coverage around what that meant, what medical nutrition means. And supply is not the same as access is the kind of buzz phrase that we're sharing. And you can contact your local media and tell them the formula crisis will not end for our community until we have safe, reliable, and affordable access to medical nutrition. And so I just want to highlight, she's on this call actually, and I want to highlight her story because it's so powerful to see what someone can do by just telling their story and reaching out to local press. So Kayla, she's from Wyoming, and she was connected with someone who helped her, and she, I think, can elaborate on this if she's here, but she was connected with someone who connected her with local press, and she did interviews with local press. It got a lot of attention, a lot of different local press or places picked it up, and then it landed a Today article. And I just want to share that article with you, just a little bit of it, because it is the most prominent mention, one of the most prominent mentions PKU has gotten in the news, aside from a Washington Post article that was about a fundraising event for PKU. But this article on the Today site not only mentions PKU, look at this beautiful, like her child here, her son needs special food and formula to survive. So this mom is on a mission. Children and adults with rare metabolic conditions must rely on expensive formula and medicinal food for their entire lifetimes. So my guess is most of you on this call have seen this article, I hope, but I just want to highlight the power that it is to just share your story repeatedly and to stick with it. And this not only was the most prominent feature of PKU in the news, but also the Medical Nutrition Equity Act. So right here today, that's why McCain has been lobbying for Congress people to pass the Medical Nutrition Equity Act. If passed, the bill will require health insurance companies to cover formula and other medically prescribed foods for people with metabolic conditions. So it's just incredible placement for this issue and for our community, and it raised the profile on the issue a lot. She also mentioned her senators in this article, I believe, and that's something that senators and representatives love to be mentioned in the news, but also there's a little bit of pressure there, right, to then act on this because it's getting national coverage or a lot of local coverage. And she wound up getting her senator, who was a Republican senator, to be a co-sponsor on the bill. So it was just a tremendous victory for the MNEA. And she's a mother of someone with PKU. and she's very busy, and she's, you know, raising multiple kids and doing a lot, and was able to make this happen. So I just wanted to highlight Kayla because I think that was pretty incredible development that we had. And then now we're going to get into sharing your story. And just a quick overview of that. And then I want to kind of open it up for questions and see, you know, where everyone's at with their advocacy journey. We have some true like advocacy heroes on this call. And then there might be some people who are considering advocacy, but haven't quite started in on it yet, or might have clarifying questions. So I want to be sure to address whatever is coming up for everybody. So the thing about advocacy is that it's about telling your story. So, you know, when you advocate, you're sharing the knowledge of something you live with every single day. And it's important to remember that you are the expert. And so these representatives and senators and their aides, they oftentimes will not know about PKU. They won't know what it is, and they'll have no idea. And will also not know what the Medical Nutrition Equity Act is. So I think sometimes people get nervous around advocacy and, oh, it's a big deal to talk to your senator or your representative. But at the end of the day, they are there to represent you and to listen to you. And so reaching out and following up with them is allowing them to do their job, and is what they're there for, to be perfectly frank. So they need you to show up, and they need you to share your story. So the tips on the right are kind of like a blueprint for your storytelling, but at the end of the day, you're sharing your story. So whatever helps you bring that home and add an emotional kind of touch to it, I say go for it. But I recommend, so this blueprint is for, you know, if you have an in-person meeting, you can kind of write this out as maybe a little bit of a guide or a script for yourself. And then also you can add in these details if you're sending an email to somebody who is your in your representative or senator's office. So start out with your name and where you live, because they really love to hear from their constituents specifically. So it's important to share that. And you can share something about your neighborhood, you know, as like a great way to connect. So what is your ask? And the ask will always be, well, for the most part, especially with Republicans, I want Senator blank or Rep blank to co-sponsor the Medical Nutrition Equity Act. And then this is the Senate number, S2013. So you would send that number to your senators. And then the House number, you would only send that to your representatives, is HR 3783. So the next thing you say is, why does this matter to you? So you would describe either yourself or a loved one's disease or disorder. So this isn't only for the PKU community, right? There's a lot of other conditions that would benefit from the Medical Nutrition Equity Act being passed, including Crohn's, colitis, which is, I mean, a very large community. So it's not just PKU, but why does this matter to you? What is your disorder? What is your disease? What is your relationship to that disorder or that disease? And then how would or how did this medically necessary treatment change your life? And that's something that's really key to include. And for me, in this section, I include something kind of like spicy and fun. I call it a spicy detail, but it's basically something that'll be hard for them to forget. And it'll act like kind of a gut punch about why this is so important. And this is the place where like bringing a banana would be something you could do. Like, you know, if I didn't have PKU, or with having PKU, one banana would be the equivalent of all I could have if I didn't have access to my treatment. A spicy detail I like to include is that, you know, on diet, or I think the way I usually say it is, if I was off diet, I would need to be possibly in a, you know, assisted living facility. I would be unable to hold a job, unable to contribute to society. I would really be struggling, not have control over my emotions. My IQ would plummet. That compared with being on treatment my entire life and having access to that treatment my entire life. I was able to graduate with honors from New York University, and I work full-time as the chief marketing officer at a creative agency. And so just being able to kind of say, you know, the difference is astronomical between having access to treatment and not, is just a tremendous difference. So you really want to find a way to highlight that. Another example someone gave to me once was the cost of formula and low protein foods a month is the same as another mortgage. So most people can relate to having to pay a mortgage. I personally can't because I live in New York City, but a lot of people can. And so that's something else that you can highlight. We're like, oh my God, another mortgage, just something that connects it to their life. So that, and that's why I call it spicy detail, because it's particularly memorable. But also kind of was like, oh, Jesus, okay, I understand why this is more important now. And then the next thing is, what does this legislation accomplish? And so that would be along the earlier points, the Democratic and the Republican sides and all those things. And then thank them for listening and ask how you can follow up with them. That's particularly important when you're meeting with them in person, whether it's in person or it's a virtual meeting. You always want to ask, how can we follow up with you? And they usually will give you an email or some contact information for how they can, how you can stay connected, and then set a reminder to follow up in a couple of weeks. So if you have any, we're going to go over questions now, but just for future reference, you know, if you want any follow-up materials or additional questions, you can email me, Lillian@npkua.org. So I'm going to stop my share now. And I just kind of want to, you know, I just talked for pretty much like a half hour. And I want to see if any of you have any questions. You can take the floor now, or if you want to just talk a little bit about your experience or any advice you have there. I know there's a couple people on this call who are very active in the PKU community, but yeah, I'll stop talking for a moment, see what happens.
Hey guys, I'm Alexa. Sorry, I'm cooking dinner for everybody. So I'm making 3 different dinners really quick, but one big key that I've had success with is social media. Everybody, every senator, everyone has a Twitter. If you tweet at them, they're going to see it, absolutely. Or someone in their office will see it, and they want to answer those because tweets don't go unnoticed. So social media and staying on them, I tag them in every single post that I do. Anyone who's in Virginia, in my state, I just tag no matter what. And, you know, I know they see it because it's been shared. So social media is key. That's how I was in a couple different. Back in May, we did People Magazine and we did CNN and Fox News and the Today Show and a whole bunch of other things talking about PKU and the formula crisis, because I have 2 little boys with PKU, and, you know, they're all cute because they're so little. They're 2 and 10 months. So, you know, they pull at people's heartstrings. So social media is what got us there. I found someone that is a senior editor in People Magazine. And I was like, hey, this is big. This is our story. It's different. Will you take a listen? And it ended up being featured in People. So pretty awesome. But social media is a huge key. So anytime you write a post about anything, I take pictures. I take pictures of our Cambrook foods, and I put pictures of our formula, and I put the prices on there because it's scary and it's sad. We pay $9,437 a month for my 2 boys for their formula. Well, insurance pays for it, thankfully, but a month in formula. How crazy is that? That's how they live. And the big thing is that is how insurance paid for our formula and our food, is because the assisted living thing. They said it would be more expensive for our kids to be in assisted living for the rest of their lives than it is for them to pay for food. So that is key to knowing that having to pay for nurses to come here would be much worse for insurance companies. So that's another thing to push as well.
I love that. Thank you so much, Alexa. And you're right, that People article was amazing. I did not mention that earlier, but that was also one of the most high profile PKU mentions we've ever had. That was awesome, awesome tips. And also the Nutrition Equity site has a place where when you put in your information, get your senators and representatives, they tell you what their Twitter handles are. So you can very easily find and tweet. You don't need to do that research on your own. It's all on the Nutrition Equity site. You can reach out directly there. So Does anyone else have any questions? Feel free to shout them out. Or if you want to talk about like where you're at in your advocacy journey, feel free to shout that out as well. And you can also write it in the chat too, just if you don't want to like unmute or if it's really noisy where you are or whatever might be going on. I'm going to give like a few more minutes to see if anybody wants to chime in with anything.
Hey Lillian, this is Kelly Hicks. I live in Massachusetts. I have 3 children, 2 have PKU. They're actually both in college now, doing very well, but thanks to our health insurance and living in Massachusetts, you know, they've had access to the best of the best formula and food. But I am concerned. My oldest, Peyton, she's 22 and she's going to be a senior in college. So, you know, soon she'll be out on her own. And so one of the questions my husband and I were just talking, is there a list of the senators that are on board, you know, like by state? So at least we could sort of, you know, start with that and then reach out to family and friends throughout the country that are in some of those target states, you know, and contact them.
Yeah, absolutely. So I'm gonna just put into the chat right now. Here's the list on congress.gov of all the current co-sponsors for the Medical Nutrition Equity Act. So I'll also just share my screen to show that to everyone at the same time. But basically S2013, this is the Senate bill. You can see these are the co-sponsors by state and US territory. They're all listed here. And then if you want to see the individual ones, they're here. So you can kind of peruse that and just see who's on board already. And then, you know, we have some specific senators that we really want to target right now. And those are ones that we believe would be the most likely to be able to be convinced to sign on. So those key target states are here in this slide, which I will send to you guys as well. And if there's any questions about, you know, what to say or what the contact information is from anyone, you can definitely reach out to me and I'll be able to send you, you know, we have a phone template. So when you like steps for what you should say, and then also an email template that you can adjust and personalize. So if anybody wants those and you don't currently have it, just feel free to email me for it. And then Riley said, once we hear back from our senators, do we need to forward the email to anyone? Yes, thank you. That's a great question. So when you hear back from your senator or your representative, please let me know, Lillian@npkua.org, because I will let Crossroads, our lobbying firm, know. And then they'll be able to take action on their end to follow up and say, we know you heard from this constituent on this date. And so how do you feel about co-sponsoring? And they'll set up meetings and be able to push that through. So yeah, if anybody's willing to do an in-person meeting, let me know as well, because we can help with setting that up if someone needs help with that. Kelly says, this is great. Thank you. You're welcome. I think advocacy truly like can sound overwhelming because anything that requires a lot of different steps can feel overwhelming. I know that is true for me anyway. So it's helpful to just have it broken down. And I think to know that you have people who are ready to help support you with the next steps. Riley says, thank you. Hoping to hear back soon from Indiana. Yeah, that would be awesome. We want Indiana on board. That would be great. And so everybody knows, like, this is the furthest we have ever gotten in the history of pushing the Medical Nutrition Equity Act through. And we're so close. We're so close. And we really need action around this to happen in the next month in order for it to have that shot of passing before the legislative session's over. So this is the time, if you know anyone in any of those states, to reach out and say, hey, can you please help us advocate for the MNEA? Because we're very close. And that includes also, you know, people talk about there's grass tops. And grass tops basically means, you know, organizations sending a letter to a senator or representative's office, an organization that is involved in the community in some way. So for example, the NPKUA, or an organization that is involved with Crohn's, or an advocate who has, you know, the ability to get a one-on-one meeting. That's what people say when they say grass tops. So if you can think of anyone who heads up an organization who might be willing to get involved on the issue, that can also be super powerful. You know, it's not just individuals advocating, though that is extremely effective, but also having the weight of like an organization or a company behind outreach can also be very effective too, in concert with the individual outreach. All right, well, I think we're at a good stopping point, unless, is there anyone else? I'm gonna give it 2 more minutes. At 6:10, I'll call it wraps unless somebody else has a question or a thought that they want to share with the group. So Alexa says, we are so close this year. This is our year. We just need a little bit more. So true. It's so true. We are so close. I mean, I cannot tell you how exciting it is that we are so close. It's really, really exciting. So we just keep putting the pressure on. You know, I heard this term recently, like, you want to be a polite pest. That's what our focus is right now. We want to be polite pests. I think people are sometimes worried about like offending someone or reaching out too many times. It's not a thing. Until somebody says no, keep reaching out.
Lillian, sorry, I'm driving. Can you hear me? Hey, just along with what you said, I just wanted to chime in about being a polite pest. I'm fond of the term. I know it's easy, especially if people say no, because there are going to be senators, believe me, who say no. And there are going to be, there's a chance that if you haven't done this before, I'm sure most of you, if you're on here, probably are kind of familiar, but if you haven't, there are going to be people who say no, and there are going to be staffers and legislative aides who don't listen. Sorry about the glare. But I think being polite is just something that's really important to highlight, because just because they say no doesn't mean that they can't help you in another way. We do have a senator in Utah who still, after 10 years, refuses to meet with me in person. But because we've been polite, like, oh, thank you so much for meeting with us, even though we don't see eye to eye on this, is there anything else you can do? And his office has actually been very helpful during the formula shortage in contacting formula companies. So I'm just saying this as a don't burn bridges by saying things that you might regret later. Even though it is aggravating, I totally get it. Just want to throw that out there to stay polite, because at some point this person may be able to help. So it's nice to, if they say no, you know, the best thing to come back with is to just say, okay, I understand that you're not going to be a co-sponsor, but how could your office help me? And that's just a good way to keep the conversation going. And it's also a great way to be able to follow up and say, okay, in 2 months, I'm going to check back in with you. And every time I check back in with my senators who have said no, I just say, hey, I'm just wondering if you had a change of heart or if you want to talk about it anymore. So they know this is something that we want. Anyways, that's all. Thanks.
That's awesome. I love it. That's great advice.
Quick question, Lillian, about California. California is obviously quite democratic, or at least where I'm based as well. And so I don't know, the ones I've reached out many times have not co-sponsored, but is it worth telling them now to to reach out across the aisle? So that's
Definitely.
what you would recommend now at this point?
That's what I would recommend right now. Sometimes, I don't know quite why, but sometimes Democratic senators and representatives don't sign on for political reasons. Like Schumer's office has told me they can't sign on publicly for whatever reason right now, but they're game to reach across the aisle and talk to Republicans. So I think that that's a great idea to definitely reach out and ask and make that ask.
Okay. And it doesn't matter, both Congress, like Senate and both.
Yeah, Senate and representatives, both.
Okay.
Yeah, thank you.
Sure. Fingers crossed.
I know. It's exciting. Where we're at is exciting. So
Okay, good.
yeah. All right. Well, thank you, everybody. I appreciate you joining this call. And as a reminder, I'm going to send this out. I'm going to send out the slide to everybody. I'm going to send out the video so people can watch it who weren't able to join us live. And then I'll also send along some supplemental materials for you to help support your advocacy journey. If you have any specific questions or any specific things that you want from me, please let me know and reach out. If you want specific language or if you want contact information, just reach out and I'll help you. All right. Yes, thank you, everybody. Bye-bye.